Happy day. I'm Dr. Paula Newsome.
And I'm registered nurse Tracy Young.
And together we're the educational faculty for Knockout Diabetes, where K stands for knowledge, N stands for nutrition, O stands for ocular health, and C stands for coaching.
So right now I'm going to walk you through some deep breath exercises. And this is very important to take some deep cleansing breaths throughout the day. You may be stressed out, you may have a challenging situation, and you just need to calm down for a moment. And so this is something that you can do anytime throughout the day.
Did you know that you can control your blood pressure by breathing? Did you know that you can de-stress by breathing? You know that you can actually not necessarily engage a lot of endorphins, but you can even change your mood by breathing. That breath is so very powerful. So this is probably one of the most important exercises that we can share with you.
Absolutely. So as we walk through these deep breathing exercises, I want to make sure that you're in a quiet and calm environment. Have a chair that has some back support, maybe arm support if you need it. Your feet should be placed flat on the floor with your legs uncrossed. And also, if you want to relax back in your chair to have your back supported, I'm going to ask you to close your eyes throughout this segment to get yourself ready for the deep breathing exercises. You're going to hear me say inhale and exhale and kind of give you a guide as to how long to hold your breaths and exhale. But I do want you to keep in mind to still do what is within your comfort level, especially if this is your first time going through deep breathing exercises. I want to make sure that you're also breathing in through your nose and exhaling out through your mouth. And as we go through the exercises, I'll make sure to guide you. So let's go ahead and get started. So close your eyes, and here we go. Take a deep breath in, 2, 3, 4, and exhale, 2, 3, 4, 5, 6. Inhale, 2, 3, 4, and exhale, 2, 3, 4, 5, 6. Inhale, make sure you're inhaling through your nose, and exhale, blowing out that cleansing breath through your mouth. And inhale again, and exhale. Inhale, and exhale. Inhale through your nose, and exhale through your mouth. Inhale and exhale. Make sure you keep your feet flat on the floor. Inhale. And last one, exhale. Wonderful. How do you feel?
Excellent.
Right?
Excellent.
It's such a great exercise that you can practice at any time to kind of help yourself be calm and come down from any kind of stressful day or an event that you're having, or just to kind of clear your mind of any negative thoughts you may be having.
I actually even inhale and exhale even slower. I even just kind of relish that breath. So I even do it at a slower count.
Absolutely.
Because my day is so hectic that I don't want that same speed. I want to
slow
really,
it down.
Yes.
Absolutely. So you can do these exercises at your own pace. It is important to have your exhale be a little bit longer than your inhale to really blow out any of that negative energy or any of that old air that's kind of circulating through your lungs. So thank you so much for watching these breathing exercises.
We want you to be well,
stay healthy,
and stay the course as we knock out diabetes.
Happy day and welcome to our program, Knockout Diabetes. I am registered nurse Tracy Young, and I'm here today to walk you through our weekly exercise regimen and introduce you to our Knockout Diabetes community. One of our program goals is to increase your activity to 150 minutes per week. That breaks down to about 30 minutes a day, and you can get that 30 minutes in each day by breaking that down in 10-minute increments after each meal. By exercising after each meal, that will give you really good effects on helping to lower that blood glucose throughout the day. I do want to give you a couple of reminders before we get started. Make sure that before you start any exercise program, you do consult with your healthcare provider. You want to make sure that you adjust your medication appropriately, as exercising does bring down your blood glucose numbers. You may have any snacks that are needed to combat any hypoglycemia or low blood sugar. You want to make sure that you have a bottle of water or something next to you so that way you can stay hydrated. Some symptoms of hypoglycemia can include shakiness, feeling dizzy, blurred vision, or being excessively thirsty. So please be mindful and pay attention to your body and your body's cues as we go through the video. You can pause this at any time and make sure that you work at your own pace. Let's go ahead and get started. So first we're going to start with our warm-up. It's very important to do a warm-up. That way you can get your body ready for the exercise that we're getting ready to do. And warm-up is going to include exercises that are very low intensity just to get your muscles and your body ready for movement. Our first warm-up exercise is going to be the shoulder squeeze. We're going to squeeze our shoulders to the back and we're going to do 10 reps. Let's get started. Very good. Our next exercise will be exercising our neck. And we used to do the neck roll, but now we're going to take one ear and touch it to the shoulder and do that on the opposite side as well. And then take our chin and put it to our chest and then also move our head to the back. So we'll go ahead and demonstrate that. Let's get started. Again. Again. One more. Excellent. The next warm-up exercise we'll do is arm circles. You're going to have your arms right out to the side of you. We're going to circle 25 seconds in one direction and then 25 seconds in the opposite direction. Let's get started. Forward. And backwards. And arms down. Great job. Make sure that you take time to see how are you feeling. Take a check-in whether or not you need to take a break, hydrate with some water, or continue going. You can pause this video at any time. Our next warm-up exercise is going to be high knees. And for this exercise, you will hold your hands out in front of you and touch your knee to your hand for each repetition. If you are unsteady or you need a little bit of support, you can use a wall next to you or you can use a chair. For this exercise, we will do 20 repetitions. Let's go ahead and get started.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20.
Great job. Our next exercise is going to be side stretches. And for this exercise, we are going to stretch to one side. We're going to do that 5 times and hold each repetition for 5 seconds and then do it again on the opposite side. So we're going to start going this direction first. Let's get started. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. Opposite side. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. Very good. Now that we're finished with our warm-up, we're going to move into our exercise pieces. Our first exercise is going to be the good old sit-up. So we're going to sit on the floor with your feet flat on the floor. And if you need anything to hold your feet down, or if you're working out with someone, you can enlist their help to kind of hold your feet down. And we're going to go ahead and do 3 sets of 10 sit-ups for this exercise. You're going to place your hands behind the bottom of your head, and when you sit up, you're going to push your chin straight up to the ceiling. That way you get really good form. So let's go ahead and get started. All right. Our next exercise is going to be the bicycle. For this, we have the similar position as the sit-up, but we're going to lay flat on our back with our feet at a 90-degree angle as we move our legs as if we are riding a bicycle. We're going to do 2 sets of 30 seconds for these. Let's go ahead and get started. Our next exercise is the plank exercise. This exercise is really going to help with your core muscle and core muscle control. For this exercise, you are going to be on your stomach. You are going to have your elbows nice in front of you, and you're also going to have your feet on your toes behind you. We're going to push up in the plank position and hold this position for 15 seconds, and we will do this 2 times. Let's go ahead and get started. Our next exercise is going to be the bridge, or what we call hip extension. And for this exercise, you will be seated on the ground with your feet flat on the floor. Our backs are also going to be flat on the floor, and we're going to lift our hips up to the ceiling. For this exercise, we're going to do 3 sets and hold them for 10 seconds each. Let's get started. Place your hands flat on the floor and place your feet about hip width apart. And when you're ready, we'll go ahead and lift straight up. So for our next exercise, we are going to do tricep extension. So you'll see that we do have weights here, but I want you to know that this exercise can be done without weights. You can use anything that you have at your home, such as a coffee mug or a can or anything that you have to just give a little bit of weight. And if you don't want to use weight at all, or if you have any kind of restrictions to this, you don't have to use weights, but we are going to use them for the purpose of this video. So with this, what we're going to do is hold this weight in our hands. We're going to place our arms back behind our heads with our elbows pointing straight up to the air, and then we are going to extend. We're going to do this 10 times, and we're going to do it for 3 sets. So let's get started. Our next exercise is going to be the bicep curl. Again, we do have our weights here, but the bicep curl can be done or modified with a can or a coffee mug or anything that you have at your home to give you a little bit of extra weight. This exercise can also be done without any weight at all by simply just moving your arms to get that mobility in your joints. Now, we will be demonstrating single bicep curls, but you can also do a double bicep curl where you hold your can or your weight in your hand and you simply move up and down like this. So there are many ways to modify this exercise but still get the benefit. We are going to do 10 curls on each arm. We're going to start with our right arm first and then move to our left arm. So let's go ahead and get started. Awesome. Switch arms. Very good. Our next exercise is going to be the jumping jack. We're going to do 3 sets of 10. Let's go ahead and get started. Ready? Go. Now it's time to cool down, and this is a very important part of any exercise as it helps your body recover from the exercises that we did previously or in any workout that you participate in. So now we're going to start with the abdominal stretch. For this stretch, you are going to have your hands flat on the floor, your elbows about shoulder width apart, and we're going to push up to stretch our abdominal cavity. And what we're going to do is stretch for about 10 seconds and do this 3 times. Let's go ahead and get started. Okay? Now. And again. Our next cool down stretch is going to be the sit and reach. So for this, you're going to sit on the floor with your feet straight out in front of you and try to pull your feet back to your knees so they're kind of at a 90-degree angle or a little bit more, so you feel that stretch right in the back of your legs. We're then going to reach to touch our toes, and we're going to hold this stretch for 10 seconds, and we're going to do it 3 times. Ready? And relax. And again. And relax. And again. And relax. For our final cool down activity, we're going to breathe in for a count of 8 and breathe out for a count of 8. For this activity, you will sit on the floor, and if you can, cross your legs or just in any kind of comfortable position that suits you. We are going to breathe in, and we're going to raise our arms above our head, and then we will count to 8, and then we will breathe out and bring our arms down for another count of 8, and we'll repeat this 3 times. Let's go ahead and get started. Go. Breathe in. And breathe out. Breathe in. And breathe out. Breathe in. And breathe out. Awesome job completing this workout with Knockout Diabetes. As always, we want you to
be well,
stay healthy,
and stay the course as we
knock out diabetes.
Happy day. I'm Dr. Paula Newsome.
And I'm registered nurse Tracy Young.
And together we are the educational faculty for a program entitled Knockout Diabetes. And we're the educational faculty for Knockout Diabetes, where KNOC, KNOC, stands for knowledge, N stands for nutrition, O stands for ocular health, and C stands for coaching. And today we are going to be talking about our macrovascular system, which diabetes affects blood vessels. I often tell folks when I'm talking to them that I want you to think about your diabetes as a disease with a water hose, and think about it as water flowing through the water hose. However, when your blood sugar goes up, it's more like mud going through that water hose. And so there are big fat water hoses and there are tiny water hoses. So today we're going to be talking about the macrovascular system versus the microvascular system. And by macro we mean large blood vessels. And so
first let's talk about some of the signs and symptoms of having really high blood sugar versus really low blood sugar. So hypoglycemia is going to be that low blood sugar. And so some of the things that you might see are your heart is beating really fast. So we would call that tachycardia. Maybe you're a little bit more irritable, that hangry, you're starting to be a little bit more irritable. Restlessness, where you just kind of feel like you can't quite settle down. Excessive hunger. You just are feeling very hungry. And then also any kind of diaphoresis or sweating. So you're kind of sweating a little bit, you're feeling a little bit more moist on your skin. And so those are some of the signs and symptoms.
And your body is doing this because it's trying to get available sugars throughout the body to nourish the body. Sugar in and of itself, glucose in and of itself, is a positive in the body. The problem in diabetes is that too much blood glucose, or your body can't produce enough insulin to effectively use the glucose that is there. And so I do have a demo, and I'll use it real quickly. And since I paid for it, I don't think I have to attribute it. But at any rate, let's pretend that this is a cell. And so what happens is the glucose cannot get into the cell, and so it stays extracellularly. With the insulin, however, what happens is the insulin allows the glucose into the cell, and you got happy campers.
That's right.
But all of those factors from hypoglycemia are there because the body is trying to accelerate and excite and get stuff out. And because it can't, it overdoes it, overcompensates. So in addition to that, the brain, which weighs less than 2% of our body, uses up roughly 20% of our body's energy, and that's pretty significant.
It is.
So you're talking about something that weighs 2% versus something that takes up 20% of the body's energy. And so it uses up so much energy even while you're sleeping. It is managing your physiological and your biological processes. Again, that's why sleep and rest time are so important.
And a little bit, too, about the glucose and the effect on the brain. The brain uses that glucose. So that's why I want to say, it's not bad for your body. We need that. The issue comes in when you're taking in excessive amounts of that glucose.
And your body can't process it.
That's
because
right.
your pancreas can't keep up.
That's right.
With
That's
the
right.
insulin production.
Exactly.
The glucose production.
That's right.
Right. And so when you eat, your body stores excess blood sugar, and your brain does not have that that capacity. So the body has to take on that function for the brain. So the main source of energy is sugar in our bloodstream that you take in from eating, and thus the brain is actively aware of when your blood sugar is high, but it's also actively aware of when your blood sugar is low. And when your blood sugar is low, the brain operates less effectively. You'll feel a little spacey, you'll feel less focused, and so we need at least 125 to 150 grams of glucose per day to operate.
Absolutely. So just a little bit more about good brain health. So sugar and the brain function, like we were saying, they are very connected. So we want to make sure that you are using, you do have enough consumption, but you're not overly doing it.
Have you ever had a brain freeze? Okay.
Yes, ma'am.
Sometimes you can get those absolutely from some of the foods that you eat, especially if you eat a cold treat. So you just may want to know that cold treats could lead to some brain fog because it doesn't allow the sugar to get to the brain quite as quickly. There are also some brain vitamins that are essential compounds that your body does need and cannot produce naturally.
Right.
Ginkgo biloba is one that has been used therapeutically for many years. Also, omega-3 fatty acids are responsible for the optimal function of the human brain, especially DHA, and especially DHA as it relates to the formation of neurons in children's brains.
Yes.
And then it's really important for you to eat fish with omega-3s. So you can eat salmon, wild-caught salmon, tuna, cod.
Yes.
Any of the cold water fish are typically high with omega-3s.
Yes.
And then I bet there's something you did not know.
One of my favorite pastimes, chewing gum.
There you go.
Chewing gum can also stimulate the brain. And so, a lot of times the teachers say, spit out that gum. Well, it's a fun fact that chewing gum can actually help with some of those functions.
And also, alcohol can damage the brain. However, it really is more impactful with binge drinking and drinking way too much.
Right.
There also are some very positive benefits on the brain of eating chocolate. And so there are tons of those, but they are beneficial, again, in moderation.
Moderation is a big deal.
Right, right. And then there are foods, are not necessarily foods, but medications that people prescribe for kids in particular. And I'm thinking about Ritalin. So that has a multitude of uses, but it also has a multitude of abuses. So if you've been prescribed Ritalin, or if somebody in your family's been prescribed Ritalin, make sure you follow the instructions on the bottle.
That's right.
So brain food is like food for the rest of your body. Too much is not good, too little is not good. You want to make sure that you provide good nutrients for your brain.
Absolutely.
So we're going to just share some brain foods that are really good for boosting your brain and your memory.
Okay, so almonds. Almonds are going to be able to increase that blood flow to the brain, very helpful. And then walnuts. And I like to look at the walnut because it looks like a little brain, right?
Absolutely.
And so it's easy to remember that walnuts can also help. They're very high in omega-3s. And so if you're not able to get it from fish or other sources, things like that, walnuts are also very helpful.
And almonds and walnuts also are good snacks to keep in your purse or keep for smaller children. They like them, and it's a real good snack.
Yes, absolutely. Blueberries. Blueberries is considered a superfood, and it can really improve the learning, motor skills. And then looking at Brussels sprouts is another really good one, and it helps convert that serotonin in the brain. And we're talking about serotonin as a very important neuroreceptor that we need.
And then there's broccoli. We eat broccoli in my house almost every day, and it assists in proper brain functioning as well as with cauliflower. So I typically say try to stay away from white foods, so stay away from rice, all those white foods. But
pastas.
Cauliflower is one of those white foods. It's actually very, very good for you.
Yes, it is. Yes, it is. It can help with the white matter in the brain and also your spine.
Absolutely.
Okay, ginger. This
Love
is a
ginger.
really good one because not only does it add some spice to your food, you know, you can have it as a tea. It has a lot of benefits as an anti-inflammatory, and it can really help protect the brain from disease.
I actually use ginger quite a bit in my recovery with the vaccine. I had a reaction to one of my shots, and it was the ginger that got me through.
There you go.
It really was.
An apple a day keeps the doctor away.
Amen.
It is very
not me,
true.
though. Don't stay away from
Not
me.
this one.
Yeah,
you need to
don't
come
stay away.
see
Yeah.
her. But it's a power food as well, and it can actually help with your mind, your body, and emotions.
Absolutely. And then watermelon, again, not too much, always in moderation.
And don't sprinkle salt on it.
Please don't. Or sugar.
Or sugar. Eat it the way it comes.
It's like, why would you do that?
Yeah, yeah.
And then cabbage. Cabbage is another one. It's a really good, and it's a good source of fiber.
Right.
So not only is it good for the brain, but it's
Right.
also really good if you're having any digestive issues.
That's right. And I like to suggest the cabbage with color.
Right.
You know, the more colorful your foods are, you know, the more kind of well-rounded they are. And so if you can get a purple cabbage, you know, I would definitely reach for that.
Right. And then lettuce, but make sure that you use a lettuce that is nutritionally good for you. So the darker the green, the better. I try to stay away from iceberg.
Right.
And more with the romaine, the arugula.
Yes.
You know,
Even
now,
spinach.
Well, which is not
Yeah.
really a lettuce,
Right.
but yeah, spinach and kale. But the darker the green, the better.
Absolutely. Cantaloupe is also really good for brain support. And then any kind of pine nuts will help stimulate brain activity as well.
So nuts in and of themselves are just super, super good. So 5 of the best brain boosting foods are oily fish, and we've talked about this before, blueberries, pumpkin seeds, chocolate, and avocado. Again, all really high in omega-3s. So talking about the macrovascular system, let's talk about lipids, because lipids are really, really important.
Absolutely. So what is a lipid? Basically, it's the cholesterol, triglycerides, all of those things that are in your blood and flowing through your bloodstream. Cholesterol, we can kind of describe it as like a waxy substance that is going to clog those major arteries and vessels in your body. And the cholesterol is going to be produced by your liver. And if your body makes too much of it, then we have a problem.
Right. And so with fats, you know, you can love them, you can limit them, or you can lose them.
That's
and
right.
especially with fats, you want to make sure that you are doing good fats. You want to make sure that you are not dealing with fats that will clog your arteries. And, you know, every now and then everybody wants, and I don't want to call a particular brand name.
Don't do it.
Yeah, I won't do it. But every now and then we like to see that hot sign on. Every
Yes,
now
we
and
do.
then.
Yes,
Every
we do.
now
We
and
ride
then.
on by and say, skirt, gotta get in there.
But it is so much better to do the unsaturated poly or mono unsaturated fats versus your saturated fats. And so you want to limit the amount of butter and cheese that you use, and you want to lose all the fats that have all the trans fats.
That's right.
Like the donuts and the cookies and the cakes and all that stuff.
So you might have heard the term like hydrogenated oils, trans fat. You know, those are what we're talking about. You want to lose those. Try to eliminate those from your diet.
And although you're not supposed to be able to get those in the United States anymore, you can.
Yeah. Read those food labels.
Yeah, they're in the foods.
That's right.
In the foods.
So then we want to talk more about how to limit those lousy LDLs, that part of your triglycerides, and how to up your healthy, your HDLs. And
so that's what that LDL and that HDL
that's what I say.
For.
Lousy, yeah. Lousy, lousy. Those LDLs, you want to keep those low.
Okay. And so, is there anything that we can do? Because I've also heard the H referred to as the happy.
The happy, yes, they can be happy as well. We want more of the HDLs. So when you're looking at your breakdown, if you've gone to the doctor and they've done a triglyceride panel, and what you're really looking at in those ranges is your LDLs, your HDL, your triglycerides, and your total cholesterol. And so you want to make sure those LDLs are lower, in the lower range, and the HDL are a little bit higher.
Okay. So when you have high blood pressure, do you want to just share what that means, or?
So high blood pressure, also called as hypertension. Most people, when you go to the doctor, it's one of the first assessments that is done where they take the blood pressure and they're going to monitor your systolic and your diastolic. And so basically what that is assessing is, you know, how hard is your body working to pump fluid, blood, all of that through the vessels in your body. And so if you're having a high reading of blood pressure, that could mean that your vessels have maybe some plaque in them, or something's going on where it is taking too long for that blood to, it's too difficult for that blood to circulate through.
And so I like to think of this as a pump, but when you have more weight, understand that your body has to pump harder, and it has to pump through a bigger area. And so that can lead to funky numbers.
Yes, absolutely. So after high school, we gain weight.
No, we don't.
Oh, not you. Everybody else. Everybody else.
That's not true.
And so, you know, it's kind of just a natural process. You know, we get a little bit older, we get a little bit heavier, and so it's very important to make sure that we're exercising and keeping an eye on our weight, because as you were saying, the more you weigh, the more body fat or body surface that you have, your heart is having to pump a lot harder to move your blood and other fluid throughout those vessels.
Absolutely. Did you know that you gain 1 pound every year after high school? So if you graduated in 1980, and I'm going to lie and say I did, then you are now
almost 39, 40 pounds heavier.
Whatever.
Told you. Unless you walk every day.
Yeah, and do 240 minutes of exercise.
Versus the 150.
Absolutely.
Okay.
Absolutely.
So let's talk about some risk factors for hypertension.
All right. So I have, I talk to people every day who say, oh, it runs in my family. Because I say, well, have you done anything about it? And they always say that it's a family curse. I challenge that, because what I do know is that my mother was from a more urban area, but my dad was from a more rural area. And when he was growing up, he worked on a farm because my grandmother had a very large farm.
Yes.
And when he became, after he graduated from college, you know, his favorite thing to do was sit in front of the TV with a remote control.
Click, click, click.
And so you can't eat the same kinds of foods that your family does. And just because it's in your family, I assure you, more than likely you're trying to eat the same foods and you're not dispensing. Remember, calories in versus calories expended will give you calories out.
That's right. Absolutely. So what I like to do with our risk factors is divide them into, what can I change and what can I not change? And so even though family history is under one of those, I can't change that, right? I was born this way. However, your lifestyle is something you can change. And so, we're not working on a farm 12 hours a day or all day, we have more sedentary lifestyles. And so not having exercise, being obese or, overweight, those are also risk factors that are modifiable, something that you can change.
Right. If you consume a diet that's high in fat and high sodium, that's another risk factor for high blood pressure.
Mm-hmm. Absolutely. Smoking is another big one.
Absolutely.
We've talked about smoking, any kind of habit. I don't like to say limit smoking, just quit smoking altogether. It really wreaks havoc on your vascular system.
Sedentary lifestyle, we talked about that. We can talk about it even more, especially when people are depressed. Oftentimes they don't want to get out. They don't want to do anything.
Right.
So we would encourage you to take that first step. As we've discussed, that's the hardest part, taking the first step. And then high cholesterol. When you eat foods that are very high meat, fatty meat products, you're going to be taking in a lot more cholesterol. So you want to limit your meat consumption as well, and especially fatty meats.
Absolutely. And then another thing, too much alcohol, that can be a risk factor for hypertension as well. And then any chronic diseases, such as diabetes, sleep apnea, if you're not sleeping, getting enough oxygen consumption while you're resting.
So there is a syndrome called metabolic syndrome, and it typically is a combination of obesity, abdominal obesity, and that's why it's important to get that tape measure out and know your BMI.
Yes.
Hypertriglyceridemia, low HDL, elevated HDL is the happy lipodensity protein, elevated blood pressure, and then elevated fasting glucose. That is a triad. You only have to have 3 of those in order to be classified as metabolic syndrome. Typically, people don't just have one thing in isolation.
Right.
So it's usually not just diabetes. It's usually diabetes and elevated cholesterol, and abdominal obesity or BMI.
Yes.
Or
we see that with hypertension as well.
Absolutely.
They kind of go hand in hand.
Absolutely. All right.
All right, so what are some signs of hypertension? Essential hypertension is something where you're maybe you're overweight, maybe you have a little bit of edema, which is like swelling. It could be in your lower extremities, so meaning like your legs, your ankles, your feet. And then secondary hypertension would be something that is you have that secondary to diabetes, or you have it secondary to high cholesterol, or secondary to renal failure, and then also any kind of other vascular problems you may have, like peripheral vascular disease or arterial disease.
Right, or even any blockages.
Yes.
That would prevent.
Yes, like DVTs.
There you go, talking that nurse talk.
That's what I do. Okay, so in the beginning I was talking about measuring your blood pressure when you go to the doctor, and the systolic number, which is the top number, and then the diastolic, which is the bottom number. So typically what you want to see is a 120/80. That's kind of your perfect picture, or what we call normal or baseline for your blood pressure. Now, the systolic number is the top number, and it's basically when your heart starts pumping and it is pushing that blood out to your lungs and through your body. And then the diastolic number is the number that's on the bottom, and that is when your heart starts to relax. So at what point do you see the diagnosis of hypertension? It could be around 140/90. And you want to make sure that your doctor has taken this blood pressure, at least 2 times, because you can walk into the doctor's office and have what we consider like white coat hypertension. Maybe you're just nervous, when you're at the doctor, and so you get a really high reading. You need a time to kind of relax and then have them take it again.
The best time to take your blood pressure is after you have sat for at least 5 minutes, not talking, with both feet on the ground.
Flat.
So you want to be relaxed.
Absolutely.
If that's a relaxed
If
posture.
you can. I know. Sitting, yes.
Okay.
So our kidney functions are very affected by our blood pressure. Even though we're talking about macrovascular, the kidney system has very small or micro vessels inside of them. And so with blood pressure is basically how hard is your heart pumping blood throughout that system. And your kidneys are these filters. And so if your blood pressure is high and it's trying to push all that fluid through, it is very easy to damage your kidneys with high blood pressure. Some of the other comorbidities that we could see with this, or complications with high blood pressure, a big one is stroke. And that being because of these vessels that we have, and by the nature of how they are made, hypertension, especially if it's left untreated, can lead to a stroke, atherosclerosis, right? Heart attack or heart failure, and also kidney failure.
So the big thing to remember again is think about a water system. And I want you to think about perfusion. And think about a stroke is a blockage of the blood vessels or the vascular tree to the head and neck. With the heart attack and the lower extremities, you have what's called a myocardial infarction, or you have a blockage either to the vessels that supply the heart or that go to the lower extremities. So again, think about perfusion, think about that water hose. And in high blood pressure, just think about the fact that it's just more difficult for the blood to get to everywhere it needs to get to.
You want your blood to be more like that water and not like the mud.
Exactly. And are you going to pay me for that? No.
I know. Trademark. All right.
So there is some end organ damage, and we've talked about it. But you can have a stroke, and we've talked about it. You can have retinopathy, and we're going to do a lot more discussion of retinopathy, and we'll show some pictures of that too. You can have peripheral vascular disease, which is why it is so important, especially if due to physical limitations, you cannot check your feet by actually holding your foot up.
Right.
You've got to get that mirror on the floor and take a look at your feet on a daily basis. You can have renal failure, very, very common in people with diabetes. And then we just talked about the heart attack.
Absolutely. And I do just want to circle back on the feet with the peripheral vascular disease and neuropathy. One of the big concerns with that is, if you do not have good sensation on your feet, that can lead to any kind of injury. So whether it's burns or open sores if you step on something. And we'll talk about this a little more with microvascular, but our wound healing is decreased if you have uncontrolled diabetes. And so you might have something that, if it's untreated, can lead to infection or something that can be life-altering.
And the last thing we would want is for anybody to have to deal with amputation. Not that it's the worst thing that could happen to you, but it's typically not a good sign of quality of life long-term. So it can be if you make some changes, but that's typically not a good sign.
Absolutely. So what are some things we can do or eat for help with managing hypertension?
there is the DASH diet, and that DASH diet seems to be better in terms of managing hypertension. And it includes doing 8 to 10 servings of fruits and vegetables per day. You have to limit the amount of alcohol and sugar, and you have to eat more protein and less processed food daily.
Absolutely.
But it's pretty much what we've been talking about all day. So you also want to exercise. You want to make sure that you, again, pay attention to your diet. You want to eat leaner meats, not meats with a lot of fat in them. The most important thing is reducing the sodium. You don't want any more than 2,300 micrograms of sodium per day. I used to eat a burger that was a plant-based burger, and I thought I was eating a healthier option, and I ate 2 of those burgers a day. I ate one for breakfast and one for lunch. Well, I was taking in 880 micrograms of sodium. Well, my total maximum allowance is 2,300, and I was trying to figure out why my blood pressure was going up.
Yes.
Well, it was going up because I was consuming, and that was just in the burger. That did not include the condiments. It didn't include the bread. It didn't include any of that.
Yes.
The pickles.
And anything else that you want to eat throughout the day. That's it.
So if you've got a headache, or you take your blood pressure and you find out that your blood pressure is a lot higher than it should be, make sure, and actually you should do this before you get to that, make sure you read those food labels so you pay attention to the salt. If they take out sugar, if they take out fat, they've got to replace it somewhere in terms of taste for the American consumer to purchase. They usually replace it with salt.
Absolutely. Okay.
Make sure you meal plan, and meal planning is just really, really, really important. And then you want to make sure you don't take in any more than 6 teaspoons of sugar a day.
That's right.
6 teaspoons of sugar. So if you're going to put sugar in your coffee in the morning, and you're going to put in 2 or 3 teaspoons, you only have 3 left for the rest of the day.
That's right.
I don't care how you're getting it or what you're getting it in, you only have 3 left.
That's right.
6 total.
You still have to leave room for your good carbs.
Absolutely, absolutely. So understand that people with diabetes are 2 to 3 times more likely than people without diabetes to have heart disease. Managing diabetes can help you control your high blood pressure. So for every 1% drop in A1C, you decrease your risk of having a myocardial infarction or a cerebrovascular accident. So a heart attack or a stroke.
So let's talk about what happens when there's too much glucose in your blood system. Again, going back to that water hose, instead of it being water, it's more like mud. And what happens is when your blood gets too sticky, it starts to attract the cholesterol. And that's how we get plaque buildup. And so where you have a vessel that is nice and round, it starts to get plaque buildup inside of there. And so instead of your blood and other fluids just running through them very easily, it starts to get a little sludgy.
Clogged.
It starts to get a little clogged. And so with that, clogging arteries, your heart now is working a little bit harder to pump that blood through those vessels. And that can cause an issue with your circulation, thus increasing your blood pressure.
And so there's a thing called peripheral arterial disease that can occur, and it definitely indicates an issue with circulation. And so you want to make sure that not only do you check your blood pressure on your arm, but you also check your blood pressure at your ankles.
Absolutely.
So there are some medications, and there are lots of them. I don't know if we should go into all of them, but we want to talk about certainly categories of medications that you can take for high blood pressure. There are your ACE inhibitors. They're often combined with a diuretic, and if you develop a cough when you're taking an ACE inhibitor, then they will stop you from taking it.
Make sure that you are in touch with your healthcare provider, about what type of ACE inhibitor you're taking and how to recognize them. They end in the PRIL ending.
Right. And then there is the ARB, and the ARBs are shown to lower chronic heart failure. So you cannot use an ACE with an ARB. The ARBs, however, are not as effective in African Americans. And so typically with folks of color, they're typically started on a calcium channel blocker and a diuretic. And the ARBs are?
The ARBs are going to end in TAN. So that's the ending, how to identify those.
Okay. And then you've got your calcium channel blockers. Those should be taken at the same time every day. And you want to take with meals to avoid nausea and heartburn. You cannot take your calcium channel blockers with grape juice.
That's right.
And those end in?
Well, these are a little all over the place.
Okay.
So there are a couple that will end in peen, but then you do have something like verapamil or diltiazem that have a different ending.
Right. And then you've got your beta blockers. And your beta blockers sometimes can be added if the first medication doesn't work. But you cannot stop taking that abruptly. You've got to adjust the dose a little at a time. And you, again, need to take it about the same time every day.
Absolutely.
And you can take it either with or without food.
Right. And something to know about beta blockers especially, but also some of the other cholesterol medications, or the hypertension medications, is it can also affect your heart rate. So a lot of education that you may get before being prescribed one of these is how to take your heart rate, because it's going to lower your blood pressure and it's also going to lower your heart rate as well. And the beta blockers end in LOL.
Good. And then you've got your diuretics, your water pills. And they work by changing how the body uses the water, sodium, and potassium. You usually take that once per day. But if you take it at bedtime, we talked about the restful sleep. You're usually not going to be able to sleep restfully because you're going to have to go to the restroom.
That's right.
And so there are some foods that you can eat that are potassium sparing. You're going to need more bananas and avocados and strawberries in your diet.
Absolutely.
Is there a way to recognize these?
With these, it really just kind of depends because actually there are some potassium sparing and some potassium wasting diuretics. So it's really important to work with your healthcare provider on which one of those they've prescribed so you can know whether you should be adding those bananas and strawberries or if you should kind of hold back on them.
Right. And as a person with diabetes, you want to be careful on bananas anyway.
Because they are sweet.
Yeah, so you only want a half.
That's right.
But you can also put the banana in the freezer.
Yes, you can.
And
absolutely.
eat it, and then it will cause you to eat less.
That's right.
We are now into our 10 for 10. And as always, we want you to monitor your vision daily with your tool.
We want you to monitor your food intake daily.
We want you to monitor your blood glucose daily and at different times of the day.
That's right. We want you to keep up with your program materials.
We want you to write in your journal when you're feeling in control and out of control, but we also want you to add the who, what, when, where, why, and how, because that may be a tip-off to some foods that may be, or some other things that may be triggering your responses.
We want you to be open to change behavior. Where are you on that continuum of change?
Right. We want you to check your feet daily. If you need to put a mirror on the floor, make sure you put a mirror on the floor, but you've got to check your feet daily. And I understand sometimes there are physical constraints that won't allow you to pull your leg up to check it, but you've got to check your feet daily.
That's right. Also, do at least 150 minutes of activity or exercise a week. Just for maintenance is the
Right.
150,
Right.
but if you really want to get to that ideal body weight, we're going to bump it up to 240 minutes.
Absolutely. And you want to make sure you participate in at least 80% of our classes and or these videos.
Okay, and then we want to fully participate in all of the Knockout Diabetes activities.
Absolutely, because we want you to be well
Stay healthy.
and we want you to stay the course as we
Knock out diabetes.